Hey guys, Andrew Darlington with Veritas Risk Management here. I'm getting a lot of people asking me questions about health sharing. What's some alternatives to group health insurance and individual health insurance? And here in a second, we're going to talk more about that. So what we've got here are health sharing accounts. What these are is I like to say it's what health insurance was supposed to be back in the day. So everybody pools their money voluntarily. And while they're pooling their money voluntarily, if someone has a bill, they say, "Hey, I've got a bill. Can you help me pay it?" And then the organization sends them checks to help them pay whatever part of the bill they're supposed to pay. It's 100% voluntary, and so I can choose to put money in there. And if I choose to put money in there, I get money back, or I can choose not to. There's nothing compulsory. When the Affordable Care Act came out, you cannot do medical underwriting for individual health insurance. And so with these medical sharing accounts, they're able to either A, do underwriting. And so if you're not healthy, they're not going to let you in, or you can get good rates because you are healthy. So because they're only allowing people that are healthy in there. Plus, most of them are going to put some pretty significant pre-existing condition limitations on there. So if you've got a back issue or you got certain issues like that, they're not going to cover that at all. And so that's one of the ways they're able to keep the price down. So generally speaking, these health sharing accounts are, 50% less, 30, I've seen 60% less than what you're going to find on the through the marketplace with the Affordable Care Act. So from a price standpoint, it's great. From a coverage standpoint, it works a little bit differently. There's several ones out there. We work with a company called Sedera. We also work with a company called Christian Care medishare. You've probably heard of them. But there's probably 10 or so out there that are fairly decent size. With Sedera, it's what we call an indemnity plan. So you don't have any network. You can go get treatment anywhere in the world, and you kind of work with them, and they are going to pay their share of the bill, and you're going to pay your share of the bill. You're sharing the bill. With Sedera, what they'll do is they'll actually work with you and the facility or doctor and negotiate a rate so you can keep your price down, which is going to help the whole group as a whole. With others like Christian Care medishare, you actually have a card and they're inside of a network. And so they get network discounts. That's a good thing because you kind of show them a card, and so it makes things a little bit easier because it's not a cash situation. But on the flip side, you are stuck in a network. And so your doctors might not be in that network. You never know how it's going to work. So the ones that have no network, generally you're saying, "Hey, I'm going to be a cash patient, and my company Sedera is going to work with you on negotiating bills, and then you're going to pay, and then they're going to help offset it." The good news is most hospitals, doctors don't expect to get their money for several months, and so you have time to work through that process before you give them a bill. The downside is a lot of those places, if it's a surgery center, that type of thing, they're going to want their money up front. And so you're going to have to give them money up front before you even have the treatment. So that's why getting it pre-approved with your health sharing organization is going to be good. The other thing to look at on these health sharing accounts is that most of them do not cover chronic illnesses. So let's say you go in healthy and everything's fine, and then boom, you get diabetes or something like that. That's going to be a chronic illness the rest of your life. Most of them are going to limit the amount of coverage that you're going to have for drugs and certain things like that. And that can be a deal breaker. The good news is because we do have the Affordable Care Act, that the next January for open enrollment, you can go into one of those Affordable Care Act plans. They can't ask any questions. They couldn't put any pre-existing conditions on there. And guess what? You're covered immediately for everything, including your drugs. So with the advent of the Affordable Care Act, there was a nice little thing for the folks that are in the medical sharing plans, because if their plan, and most of them do have a cap, an annual or a lifetime cap, if you do start to reach that cap, then again, January 1, you can always go into a new plan, and you don't have to worry about pre-existing conditions, and you're going to be completely covered under that. So there's a lot of benefit to these. The biggest is price. With some of them, you can do a little add-on and make it health savings account qualifying. So you can do an HSA, Most of them do not do that. Deductibles are kind of different. Some of them with sedera, they actually do a per incident deductible. So if you get cancer from the first time you went to your primary care and they said, we think you have cancer, all the way to the last treatment, it's one deductible or one initial household portion or initial shareable amount or whatever you want to call it. But it's for layman terms, it's a deductible, but it's not legally a deductible because there's no deductible because of health sharing. But they do that. Other ones work very similarly to to a traditional deductible. You have one annual household portion, so that's the amount that your family would pay during the year, and then after that, the health sharing organization kicks in. If you have questions about these things, please call our office. Happy to help any way we can. Like I said, we do work with folks with sedera for groups and individuals. We do have several groups with sedera. With Christian Care medishare, we can also do groups as well. And then we can also do individual plans. And then we have the Affordable Care Act plans as well. So whichever way you want to go, if you need to save money and want to do a sharing one, we're happy to help. If you need the other one, we're happy to help on that as well. And we can also do group plans. A lot of people don't know that it's only one person with some group carriers. We can do a Blue Cross Blue Shield group with one person in some situations. So that is also an option as well. As of today of this recording in 2022, Blue Cross Blue Shield group plans are a lot less expensive than non-subsidized individual plans on the marketplace. And so that might be an option as well. So if you're a small business owner trying to figure out health insurance, sometimes we can do a group plan for just you and your family, and you're all set and you can take care of yourself that way. Thanks again. 423-292-4142 is our number. You can text it, you can call it, go to our website, veritasrm.com, or and reach out to us in any social media platform. And you can always email us at help@veritasrm.com. Until next time, thanks and God bless.